All right, let's dive right in. Today, we're going to decode one of the most fundamental ideas in respiratory health. We're talking about the absolutely crucial partnership between the air we breathe and the blood that flows through our lungs. I mean, have you ever really stopped to think about it? What actually makes a single breath perfect? It feels so simple, right? But behind that easy inhale and exhale, there's this incredible, complex dance going on.
And at the heart of this dance, you've got two main players, V and Q. The best way to think of them is as partners, and for our lungs to do their job right, these two have to be moving in perfect sync.
So first up is V. V stands for ventilation, and really all that means is the air supply. It's the simple act of getting fresh, oxygen-filled air into those tiny little air sacs deep in your lungs.
And its partner is Q, which stands for perfusion. Now, this is all about the blood flow. Think of it like a river of blood flowing through tiny little vessels that are wrapped all around those air sacs, just waiting to pick up oxygen.
So in a perfect world, these two are perfectly matched up. For every bit of air that comes in, there's the perfect amount of blood ready and waiting for it. The ventilation matches the perfusion. That's the ideal VQ ratio, and it's when everything works as efficiently as possible.
But what happens when that partnership falls apart? You know, when the balance is totally out of sync? Well, that's what we're here to talk about today. That's the V/Q mismatch.
A VQ mismatch is, you guessed it, exactly what it sounds like. It's when the supply of air and the supply of blood in the lungs just aren't lining up. This imbalance is a huge deal in a lot of lung diseases, and it tends to happen in a few very distinct patterns. So let's start with the most dramatic examples, right? The all-or-nothing scenarios that are on the complete opposite ends of the spectrum. We're talking about dead space and shunt. Okay, first up, dead space. Just look at the diagram. The blue lung on the left, that's our ventilation, and it's totally full of fresh air. Great, but hang on, where's the red for the blood flow? There's none. That's the whole story of dead space. You've got ventilation but zero perfusion. It's like having a delivery truck full of goods with no road to drive on. So what could cause something like that? Well, a classic example is a pulmonary embolism. That's a blood clot that just completely blocks off an artery in the lung. The air gets in just fine, but the blood simply can't get there. All that ventilation is essentially wasted. Now, let's look at the complete opposite of that, a shunt. In this case, you can see there's plenty of blood flow. The red is strong, but look at the blue lung. It's collapsed. There is no air getting in to meet that blood. So this time, we have perfusion, but no ventilation. This is what happens in conditions like pneumonia or really bad pulmonary edema, where those air sacs are just filled up with fluid instead of air. The blood just flows right past those areas without ever picking up a single bit of oxygen. It's completely wasted perfusion. Putting them side by side like this makes the contrast so clear. Dead space is air with no blood. Shunt is blood with no air. And look at how this impacts the gas levels in our blood. PaO2, that's oxygen, and PaCO2, carbon dioxide, they move in completely opposite directions. For doctors, this is a massive clue to figuring out what's really going on. Okay, so those are the big all-or-nothing extremes. But often, the problem isn't a total shutdown, but more of a relative imbalance. So let's check out what that looks like with low VQ and high VQ. So here we've got a low VQ mismatch. You can see there's some ventilation. The blue lung isn't completely out of commission, but it's way less than the amount of blood that's flowing past it. It's a classic case of too little air for the amount of blood. This is the hallmark of conditions that block up the airways, things like asthma or COPD. The air is struggling to get in, but the blood flow is still chugging along pretty normally, and that's what leads to that low V/Q ratio. And on the flip side, we've got a high VQ mismatch. Here, the problem is completely reversed. We've got plenty of air getting in, no problem there, but the blood flow is weak, it's reduced, so that creates the opposite imbalance. Too much air for the amount of blood that's available to receive it. We see this with diseases like emphysema, which can actually destroy those tiny little capillaries around the air sacs, or in diseases that restrict blood flow. The ventilation is fine, but the perfusion is what's compromised. And just like we saw with the extremes, when you compare these two, you see that same mirror image. Low VQ means too little air. High VQ means too little blood. And again, this causes those blood gas levels, our oxygen and our carbon dioxide, to shift in opposite directions. All right, we have covered a lot of ground, so let's just take a moment, bring it all together, and do a quick recap of these 4 key patterns of VQ mismatch. And here it is, the whole shebang, the complete picture, all 4 patterns in one place. We've got dead space, all air, no blood. It's total opposite, shunt, all blood, no air. And then we have those relative imbalances. Low VQ, not enough air for the blood, and high VQ, not enough blood for the air. 4 patterns, but it's really just one story of a partnership breaking down.
This table gives us that final, crystal-clear summary. The key takeaway here is all about waste. Dead space is wasted ventilation. Shunt is wasted perfusion. And those relative imbalances, high VQ and low VQ, they're really just less extreme versions of the same exact problems. It's all just a spectrum of imbalance between air and blood.
So now you can recognize the patterns that mess up a perfect breath. But this leads to the real multi-million-dollar question, right? When a patient is sitting in front of you, struggling for air, how do you figure out which one of these mismatches is actually happening inside their lungs? Well, that's where the real detective work begins.